Welcome to Sex, Race, and Money with me, Jenny Lewis. Are you someone who wants to change patterns of unhealthy behavior? Do you want to learn the personal truth of who you really are and be more of that person every day? Do you want to have more connection and intimacy with your friends and loved ones? Are you ready to talk honestly and freely about what life is really like? Then this is the show for you, because it's dedicated to helping us cut through the bullshit and look at and love what is truly ourselves, our deeply complex, non-conforming, beautifully human selves. We'll hear from everyday people and top experts, and I look forward to sharing this journey with you. I'm a lawyer turned life coach helping real women heal around the topics of sex, race, and money. To stay connected to the show and never miss an episode, please subscribe and join our online community at Sex, Race, and Money with me, Jenny Lewis, or at the website, jennylewiscoaching.com. All right, everyone, we're here again with Dr. Sadeghi, Habib Sadeghi, and we have a couple of special guests with us as well. We have Jeni Zanotelli, and we have Dr. Debra Wickman. It's going to be a really special podcast for us today. We're going to learn a lot and share a lot as usual. Dr. Sadeghi, as you all know from the first podcast, is a doctor who combines East and Western medicine. He has a deep knowledge of healing, both in the spiritual and physical realms. Jeni Zanotelli is a patient of his and a good friend of mine here too. She is a deep spiritual healer with knowledge in many realms as well. A pretty magical woman, which you will soon find out. Debra Wickman, I'm going to let Dr. S introduce.
It's thank you for that introduction. It's really a privilege to be here and for our intentional healing community. And so I want to tell you a little bit about how I've had the privilege of connecting with Dr. Whitman. As someone who's been interested in this connection of mind and body, about a decade ago, I came into an idea and a thought while studying why is it that there is a gender predilection when it comes to autoimmune diseases, right? 10 to 1. Diseases such as lupus, Hashimoto's thyroiditis, rheumatoid arthritis, autoimmune hepatitis, on and on and on. For every 10 women, only one man will get these diseases. So with that in mind, I started studying psychoanalysis. And one of the theories in psychoanalysis, based on Freudian psychoanalysis and Melanie Klein, is that there is a low-grade, free-floating anxiety in women. And it has a lot to do with not being able to visualize their genital organs, you see. When you're a man, things are a lot more externally oriented and visible. But for women, and especially as a little girl growing up, it would be very difficult to have the abstraction of, I have everything and perhaps even more sophisticated, but it's in a negative space, right? And it's life-giving and so forth. So with that in mind, I was looking for a gynecologist that would be willing to take women into the huge galaxy of internal organ, because as a family doctor, I was trained in doing pelvic exams and pap smears and so forth, but it was almost always the woman, you're sitting on right opposite side of the woman on the other end, and there is such a sense of disconnect, right? That, and it was so impersonal, right? So what she does is revolutionary, and that's why it's really my privilege, not only as a colleague, but just as a human being. Her innovation and what she has contributed to this field and how healing and the results that she's getting. That was really for the main reason of us coming together. So having said that, I wonder, Dr. Wickman, if you could just share in terms of how you approach your pelvic exams.
Sure. Well, I've been a gynecologist for 25 years. And then not only that, but because it's such a, sacred trust type of profession, this bond we develop with women over their intimate anatomy, I, over the years, was frustrated with how disconnected, like you mentioned, women get with that. And I sought ways to try to help women with that. Became a sexuality counselor, did a fellowship in female sexual medicine. And so through all of those experiences, plus my clinical patients, have come with this idea for bringing something that women often dread, the pelvic exam, the pap smear. Women don't look forward to that in general. And why is that? It's because we're ashamed of our bodies. We don't understand our bodies or how they function. And women always think negative things, especially about their genital anatomy. They either think it's too big, too ugly, too smelly. There's always something wrong with it.
And the medical model treats it almost like a black box.
Right.
Like you don't know anything about it, right? You come in, you disrobe, you get into this, right? And a sample is taken, and then weeks later you're told if you have cancer or if you have this or not. So you don't really know what's occurring.
It's a huge void. I know that women lay there making up stories in their mind about, well, I guess if she's not saying anything, maybe that's good. But if nobody's telling them what they're seeing, they don't understand, and they don't, and they usually think the worst. They think, well, maybe she's not telling me that I have cancer or something horrible. So I started thinking, what if we could change things like that? While she's laying there experiencing this exam, actually have her participate in it, learn from it, be an active player in it. And so this evolved into developing a technique where she holds an iPad or a digital tablet, and then I have a little transmission device that's attached to my colposcope, which is kind of a microscope with a light that points at the area. Anyway, that transmits to this closed loop Wi-Fi onto the iPad. So the bottom line is she gets to see in high definition all of her internal anatomy as I'm examining. So in real time she's experiencing this, and then externally as well. What I've turned this into is even a form of therapy of sexuality counseling that I do. So we talk about things first, and what I do is based on Dr. Gina Ogden's 4D wheel of sexual experience, where we realize that as a being, we're not just the physical. And as physicians, we shouldn't only just deal in the physical, because there's the body, but then there's the mind, the emotions, the heart, and the spirit, or the connections as well. And so this method takes all of those into account by, first of all, really putting in, I have a little table where a little 3D pillow of the vulva is in the middle of that table.
I've seen that.
And yes. And we talk about her life journey from the experience of her genitals. And it's really the first time many women's genitals have had a voice, and explaining through that life journey the body, the mind, the heart, the spirit of that part of her anatomy. And all that's come across.
Dialogue.
Yes, totally the vagina dialogue. And in doing that, what I uncover in each of those areas are typically the negative current reality things that are distressing her and causing blocks in her relationships and helping her not, preventing her from engaging with life. But then we take it a step further into what would she wish for? What is that wished for state in each of those realms? And so that gives us a way to see where she is, and then to reframe that to where she wants to be. And then that's my role through our interactions together, however long that takes, in helping her devise a plan and taking an active role in going from current reality to that wished for state, that morphic resonance of, changing your body, changing your beliefs, changing your emotions, and changing your relationship by learning about yourself and by understanding your form and your function, and learning to love that and appreciate it. And radiates outward, not just with herself, but her partner and life overall is what I see. So it's like become my joy of taking care of women in this way, because it's really, I feel like it needs to disrupt the whole way we practice women's health care, you know.
I think it's beautiful. It's very different from anything that I've experienced in going to a gynecological exam. It melds together in a beautiful way what I've learned about my body, like as a spiritual being, and then also just really coming to a place of appreciating my feminine in a way that I'm really just beginning to. The approach allows the resolution of the mystery of what it means to be with me. I think I actually the revelation I had once. That I'll share around this was actually I had sex with a woman just because it was something I wanted to explore, and it was from that experience that I was able to understand like the beauty and the pleasure of what it is to be with me. And so it was like through another person, and what you're offering here is a way to really be and see yourself, like not only physically, but on a real the belief in the body level, which is really it changes everything in the way that you said. Just in hearing you say it changes everything for me to know and appreciate myself in a way that is internally beautiful and enlightening. It changes everything that I see around me because I have that deep appreciation for myself, and I don't have to go finding it in other places. Yeah.
Yeah, that's powerful. Women, I find, they don't typically look at themselves with a mirror. They don't understand. They kind of just deny. I call it intentional neglect, because we tend to busy ourselves with our families or with our partners or our careers or our community, whatever it is. We're multitasking all the time. And we tend to just put our sexuality on the back burner. And then society sends us a message that when we're no longer reproductive, no one cares about that anyway. Oh, you don't need a pap smear anymore. We don't need to see you anymore. And women feel like, okay, well, I guess there's nothing going on. It's just part of aging. And I feel like there is no expiration date on sexuality and pleasure and healing and feeling good. And so my big role is to really reframe that and help resolve pain and help women understand how to have orgasms and how to have arousal and how to improve desire.
Why would that be important? Why is that important in the context of human health? Based on your, a quarter of a century of experience and wisdom and empirical studies of seeing women.
It's really at the core of who we are. I mean, if we don't love ourselves and don't develop that part of ourselves, I mean, it's one of the basic drives of being alive. It's right up there with, hunger and, shelter and love. And we really need to have sexuality and that bond that develops with another person or within ourselves. And so without that, we're missing part of what activates, what lights us up, what helps us interact in the world and life. And so pleasure is part of that. We need to, I feel like as a gynecologist, we're kind of guardians of those organs, and yet we don't do a very good job of letting women know that they have permission to have pleasure. We like to talk about pregnancy and pathology, but pleasure is right up there in that triad, and we tend to just ignore that because we're not comfortable with it. But women need us to be comfortable with it, because otherwise they're not. And so they need a trusted source to find out about it, ask about it, get clear on where they're at in the scheme of things, and then be guided toward, being the optimal way they can be and healing these barriers. I see women that are so shut down with, their muscles in their pelvis get all tight and clenched and constricted, but they don't understand it. It's below their conscious awareness. Their partner, if he's a male, may say things like, feel like I'm hitting a wall, can't even penetrate. And they're labeled with diagnoses like vaginismus or, scary sounding things like, just things are too tight, things are too narrow. You just, it feels like rejection from society. But with this method, you can really just see what's going on. She can see those tight muscles. She can learn kind of in a biofeedback way to help them relax. And just really looking at all the layers of what is contributing to that. And then, individualizing it to find a way to help her heal, whether it's in physical things or emotional things that are binding her up.
I know that you've done some studies in terms of one of the age-old wisdoms of using jade eggs in terms of rehabilitation of pelvic floor. And I wonder if you could speak more to that in terms of your empirical observations.
One of my colleagues is very versed in helping women with this jade egg, for instance. And I was interested in it as, for instance, a tool of connection. You can use almost anything as that tool of connection. Pelvic floor, trainers, dildos, whatever your special object is that you're attracted to, a crystal dildo. I mean, women choose all different types of implements like that, and jade egg being one. And I was curious about, because there was quite a bit of polarizing media about it. Some doctors saying that it would cause toxic shock syndrome and you shouldn't put rocks in your vagina. And then proponents of it saying, no, it's helping with centering and grounding and that kind of thing, energy. And so I decided it would be good to find out what is the truth. And so we did some studies, some swabs of women who use jade eggs regularly, compared with controls, women who don't, just to try to delineate the microbiome and find out, is there something harmful with it? These studies are still underway, but preliminary data, we've seen some very interesting results in that, and this is without any kind of external hormones or medicine. It's just simply, doing a intentional, deliberate practice with something like this jade egg, little egg-shaped piece of jade. And we found statistically there was highly significant improvements in vaginal lubrication, decreased dryness, decreased pain. Subjectively, women felt more connected to their bodies. They felt more connected to their partners just from doing an intentional daily practice with this.
Which would include what? Intentional daily practice is?
It can vary. There's various exercises they can use it for, but typically it involves inserting it slowly and intentionally into the vagina. There's a lot of practices that take place before they do that too. But anyway, it ends up with them inserting it and then in various ways can develop the pelvic floor muscles with, practicing resistance against it or relaxing, modulating with it. And then while they're doing that, they can do mental visualizations and, going through a practice of affirmations or positive beliefs, whatever they have tailored it to.
It feels like this is a way of waking up the woman's internal healing abilities in a way that she may not have been aware that she had until you allow her to see it and feel it and like tune into it, both in a physical and also in a practice kind of way.
One good point on that is that without an object inside there, women can't often detect like the strength of their pelvic floor. It helps if you have something to grasp around, you know, whether it's your partner's penis, if you have a male partner, that's a good object to practice on. But intentionally and daily, just within yourself, if you're practicing it around something like a jade egg to focus on, you can really feel that resistance better. You can even move the egg up and down a bit inside the vagina and feel that power of, you know, being able to move it and lower it and, you know, control it a bit as you get more in tune with what your muscles and tissues can do there.
Yeah.
The other thing is women often aren't connected with what those aroused, you know, engorged tissues feel like.
Yeah.
And when you have, again, something that is providing some resistance and getting your attention, you begin to understand, you know, as if blood flow is improving in that area, now that tells you what those sensations feel like and what arousal feels like and engorgement feels like.
Yeah.
So it's a really good tool to tap in and focus on that. So really it's about the desired outcome with using this as a focus object, and much more so than it providing, you know, a magical experience.
Yeah.
But
And then just to take it a little further, like the engorgement that we talked in the first episode about sexuality as a healing process, but yes, and we can break it down just a bit further. We can, you know, once those muscles begin to move and wake up, what happens next?
well, when those muscles begin to move and wake up, and she realizes she can modulate with strengthening them as well as relaxing them, because some people think it's all about just Kegel type contractions.
Right.
And that's only the half of it. Women need to also learn the relaxing, melting open, receiving, surrendering part. And so that's that half women have a lot of struggle with, because we don't hear about that.
Yeah.
And so when she's learning how to modulate this and feels the strength and the contraction, and also can, you know, relax and melt open, and that is an important awareness to bring into, you know, sexuality too.
And so it is a way to open and allow the sexuality to come in.
Yes.
Yeah. In a way, in the beautiful way that you described in episode 1, like where it's deeply connected and intimate in such a way that she heals her body as she heals these muscles, but she's also healing her soul and its connection to others in a deeper and more intimate and surrendered way.
And you're also shifting the nervous system right, into more of a parasympathetic,
Right.
which is a prerequisite or the precortical terrain for healing.
Yeah.
And these muscles, they're not inanimate objects. These muscles are wrapped inside, if you would, myofascia, and which looks like a surround wrap, and that is connected with everything. And these muscles, they have nerve endings and fibers and lymph nodes. These muscles, they have neurolymph areas. That's one of the most powerful parts of the body that before the discovery of anatomy, we would refer to it, for instance, within the Sanskrit culture, would refer to it as the chakra system. But after the discovery of anatomy and dissection, we see how rich those areas are with blood vessels, with lymphatic vessels, with nerve endings, and so forth. So that's really the life force within the field of osteopathic medicine. That's what we refer to.
That's actually one thing that I'm working on myself, and it's like for the purpose of increasing my calcium and bone structure is moving into that. What was it?
Rest, rumination.
Yeah.
Because we live in a society that we're continuously bombarded with news, with various different frequencies, Wi-Fi's, foods that the body was not even used to.
Yeah.
We're bombarded with what's referred to as xenoestrogen, Xeno, xeno, foreign
Yeah.
amount of estrogens,
Yeah.
right?
Yeah.
So the body gets into this place of, is it safe or not? And we get locked in it.
Right.
Amorphic resonance is nothing more than a consciousness or a Wi-Fi. So right now we're sitting here, 4 of us, we're holding a space. What is being created is a Wi-Fi. It's invisible, just like the Wi-Fi that is in any place. And you come in and you have a receptor that's called a smartphone, and it gives you the choices. These are the Wi-Fis that are available. What do you want to tap into? So that's really what amorphic resonance is. So when you have 2 human beings, there is amorphic resonance that gets created, which we refer to it, for instance, as third consciousness.
Right.
So, when you have, 4 people, now there is a 5th component, which is the morphic resonance that you're creating.
Yeah.
That was really the essence, the age-old wisdom, the sages of burning their incense or sage, right? When you burn sage as a plant has highest level of corticosteroids, right? In medicine, when we get stuck into when we get to this cold sack of not really knowing what to do, what do? We give steroids because it works and it moves things forward. Sage has one of the highest level of steroids. So when you burn it, Native Americans, they knew about this. That's why they did sage. It breaks up the morphic resonance. They refer to it as a clearing. You see? That's why when, the temple or that place that was sacred, they would do the clearing. They break, they open up, they create a spaciousness, and then they would come into it to have a communication or dialogue.
I see. Yes. Yeah. So just to bring that into I'm just putting it together. So I know one of the things I'm doing now is I talked about changing the nervous system so that I'm more open and surrendered. We're talking about muscles and the pussy and the vagina to open those. Then there's the tapping into the there's all this information coming in from the external world as well, a lot of which I've already begun to change, like my hair and my makeup are all had to change and everything. But is there something to that, and now my body probably feels, my guess is, safer, less having less armored.
You're more pliable.
There.
Yes.
So if you want to, bone, right? What is bone? Bone is when you look at a person and they have, let's say, osteopenia or osteoporosis, thinning of the bone, or what occurs is bone is tied into level of integrity.
Yeah.
Right?
Yeah.
So when, let's say, that may or may not be true for you, but
right.
For instance, generally speaking, when you look at a person that they're continuously being attacked or their integrity is being questioned. So the way that the body works with that is they start losing calcium. You see, they will piss out their calcium.
Right.
Now, this is the way that we've been relating to the feminine in our society.
Yeah.
Because if you're not youthful, if you're not fertile, if you're not producing, you are disposable. So then towards the end of their age, 50-year-old women, it's very common for them to be stepping over a curb and they get a hip fracture.
Right.
Because they have osteoporosis or osteopenia. So the conversation, right, you have 3 daughters. What you've started, the intent, is to really create a new line of energy for your daughters to walk into. So when they go in and they have a medical exam, but it becomes a psycho-spiritual and uplifting experience rather than being dissected and pathologized and looked at, is it good, is it bad, are you going to die, are you not going to die? See, the conversation is, could we come in, could we step forward as a society and actually focus on health, healing, and consciousness and how they're all related with each other.
An honoring of the soul.
Absolutely.
At the deepest level. And I feel like it's like integrity is one that's up for me, and Jeni can probably speak to her own experience with this too. You know, as we are women who are creating a lot of new things and really having to find deep integrity in ourselves, you know, as we move forward. And it feels like life is bringing to me in many ways places where I'm going to have to stand up for myself and talk, you know, in the deepest of tensions, right?
Filling in. Your bone is filling in.
Yeah, it's wanting to fill in.
Correct.
That's exactly right.
Right.
And so I think that it's amazing that's why I knew that it was something my soul needed, you know. But
That's more exciting, isn't it?
Yeah.
Instead of saying, see this pill, it's called this. Well, you're going to be taking it for the rest of your life.
Yeah.
I mean, right?
Yeah. I mean, all of my aunts are working on their bone structure as well, you know, and these are very strong women but there is a stigma attached to like, what is my value and worth at 47?
Yes.
Yeah.
What is it like to be a 47-year-old Afro-American woman in our culture currently? You know, that's what you're looking at.
Yeah.
And you're shifting and changing that line of energy that is coming through you and making it easier for a lot of other people. Right?
Yeah.
But Jeni, if you want to speak to this, like for instance, some of the interactions that I've had the privilege of working with you and your husband, like you taking a stand for him and his health. You see? I mean, that's really a true partnership. Talk about intimacy.
Yeah.
Right? Is that...
Yeah, that's one of the things that comes up for me as we're talking all about intimacy is like that's something that's been a really big passion of mine is my own sexual health. And I love that, you know, when I grew up, you never went to your doctor, your gynecologist for sexual health. It was always for the pap smears and for that. And so I can only imagine the amount of power and confidence that's actually shifting the mind-body connection to be able to see your own insides. You know, I've never seen myself climax. I don't know what I've seen like another woman climax, but I don't know what my body looks like. I don't know like what muscles actually contract when my body has a climax. And so for me to be able to like actually see that, like I can only imagine the psyche and the physiological connection in my own body. I mean, I've seen my babies be born and I've seen my own vagina, like, but I've never actually seen inside. And so, you know, my own sexual health is connected to my partner's sexual health. So my awareness, and it's all connected. So my awareness of my own sexual health, my own body is connected to my partner's.
Right, your own acceptance of your body. Yes, because you have to accept yourself, then your partner can accept it, and you can believe that they accept it.
Yeah.
And there's a wholeness that occurs.
Yes, that's
There's
exactly.
a wholeness that you know comes forth. I mean, maybe you can speak to this, Dr. Whitman. You know, there's a whole field of radiology, right? That's what we do, right? You look at radiological studies, X-rays, ultrasound, MRI, CAT scan, and I can't tell you how many times I've had a patient with recurrent, let's say, a particular joint pain that they just believe that something is wrong. But you get a radiological study and you say, you know, everything is intact. They can actually see it. Poof, the pain disappears.
Right.
The pain disappears. So I think there's beauty in the revolutionary methodology that you're offering, right? Which is not really technology invested. It's not very financially, right? I mean, in terms of the equipment that you need
no,
to be
it
able...
doesn't cost much at all. It's typically equipment we already have as part of performing care.
Right.
Yeah, I find that it's part of the beliefs that we start to make up in our mind as far as gynecologic pain.
Yeah.
Because women are disconnected, we can't name usually where it's hurting. It's just in this general, it's in my vagina. But when a woman tells me she has pain in her vagina, I never know where that's really going to be because she's usually referring to it vaguely. And so with something like this, where she can actually see and direct me to that area, then she sees, oh, there's that little fissure that happened, you know, during, you know, rough sex or whatever, or that she's menopausal and now it's starting to be dry and thin and fragile, and there's a little crack in the, you know, so she sees exactly where it's located. Once you see that and connect with it, you know how to heal it then. You can send that healing energy to it. You know exactly where to maybe apply cream if that's indicated. So I feel like it's a whole healing process of filling in all those gaps that our brain doesn't process well because it's mystery.
And what a powerful opportunity, especially, I would imagine, and please speak to it, if you've had an experience where you've had a patient that they've had a traumatic experience, right? It could have been violence. It could have been maybe perhaps they had recurrent herpetic infections and so forth, where they can actually visualize their internal organ and they see the wholeness.
I had a case exactly like this where it was a woman in her 50s who had never been able to have an orgasm. And this really bothered her that her whole life had gone by so far without anybody being able to explain why. When we encountered her genital anatomy and her reproductive anatomy, and we had discussed like any traumatic life events that had happened along that journey, she had had an abortion that was forced upon her when she was 17 by her parents. And she had tried to like put it aside and never think of it again. But clearly it was something that was repressed and it was in her body as a barrier. And it wasn't until she saw her cervix on that iPad and realized that's where it happened. That's where that cannula went through and suctioned out that embryo. And when she saw that, it was like this huge encountering, you know, of all the sadness, all the guilt, all the remorse from all those decades was just like focused on that cervix. And so to help her really experience that, I mean, I touched it with a swab. Feel this. This is you. This has been here. And what she had to do was release it and then forgive. Forgive it. Make friends with, you know, love it. That's her body. That's her cervix. Connect with it. Yes. And it was so powerful. And everything shifted in that one encounter. And she was able to go on and experience an orgasm later with her partner for the first time. Because she was able to release that. And she didn't even realize that was hidden within her.
Compartmentalized, armored, and a lot of what we carry, it's invisible to the naked eye, right?
So
and it's
much.
when you go there and you visualize it, the whole reconnection, the whole creative visualization takes place. And then what you've walked her through, it's almost intentional forgiveness. That you breathe into that particular organ, that it's part of us.
Yeah, of letting go so that she could be present to who she is now. Yeah, it's so important. And I can't imagine how it would be, you know, I'm thinking of the way that I used to do gynecological exams. And it feels to me like there would be a gap, you know, between me and, you know, between me being there on the table and the me and my soul, you know.
Right.
Yeah. That would never be connected.
And there's often a physical gap because, I mean, we give them a sheet to put over the lap so the woman's laying back and not even seeing the doctor's face usually because that sheet is there. So your brain and your heart are disconnected from the whole experience.
Yeah.
You're just hoping to get it over with fast.
Yeah.
But you walk out of there with, you know, not being any better for it.
Yeah, and really relying on this other person, whatever that relationship might be, to guide you through. Yeah. It's a beautiful.
The connection is one of the biggest healing pieces of it is the connection. The woman being able to connect it to her own genitals and then connect it with the doctor as well. You know, most of my exams, I mean, I'll admit I haven't had an exam probably in 5 years. I haven't been. And like as we were seeing her talking, I was like, wow, because I had a hysterectomy like 12 years ago, but I don't know what my insides look like since my hysterectomy.
Right, and that would be fascinating. Women are fascinated with seeing that seam at the top of the vagina and understanding you know, the vaginal cuff and where the cervix used to be.
Yeah.
And then working their way down to see all the different zones in the vagina, the, you know, Skene's glands, the ejaculatory little ostia that women squirt from.
I don't know. I think I know where that's at, but I haven't seen
Right.
it on a big screen. I mean, I know that happens, and
Mm-hmm.
I've seen myself the experts of that, but I've never actually seen. Okay, point out this is the actual gland. So when it's happening, that like it's something that I've made some visual connection to that part of my body.
Right. Yeah. Another feature of it that's really helpful to women is they can even do little screenshots of particular things they like
Okay.
to either look at later or bring home and show their partner.
Or
I've
meditate on.
Or meditate on,
Meditate
yes.
Or do other visualizations because they have
Yeah.
an actual picture of their own inside.
Their own anatomy. Or they can even bring their partner in for this exam so their partner can participate and see and hear and understand everything too.
A deep appreciation for something that was previously unknown and would be missed. I like that. I'm going to turn this a little bit because we had talked about STIs, and that was one thing that that Dr. S and I had talked about earlier. And so I really wanted to hear, given that I have too HPV and genital herpes, I wanted to get to have your view of what it means sexually, like from the perspective of this this emotional connection to the body, mind, and spirit. Yeah.
Well, women develop such shame around, particularly those two, because they're, you know, viral infections that we carry for years. You know, we never know when they're going to manifest or show up. And there's so much shame involved with society,
Right.
you know, with like, oh, that was bad that you got that. And now you have to tell everybody that you're going to have sex with because, you know, it's like you have this scarlet letter on you.
That's it.
And you have to share it, you know.
Yeah.
And so women feel so inhibited about that and remorse and shame and shut down around it.
Right.
And in doing that, they blow it up in their mind way worse than it is. I see that all the time. Women are asking, you know, what does it look like in my HPV? Or, you know, and they're often surprised when they find, you know, you can't even see it, you know. And then the body can make it dormant. The body can suppress it. The body can clear it. So I find as part of that connection is, and with herpes as well, when you learn to accept yourself and you transcend that and you don't feel that shame, I feel like you can heal enough that those nerves aren't going to keep having to erupt it. You know, you can decrease your whole parasympathetic flow then becomes more supportive toward not having that anxiety state, not having those nerves flared up and inflamed.
Right.
And those are the things that cause the HSV to come down the nerve terminals and cause eruptions.
Nice.
So it's all part of that healing process. And you can then have it be, you know, few and far between.
Yeah. Thank you.
Yeah.
It's really helpful. I did an article. I don't know if you're prepared to speak about this, so you tell me. I did an article for a group of women who have HIV. Just talking about my own experience with HPV and herpes and genital herpes, and just from a perspective of, you know, that the scarlet letter perspective. And they said that they had never had anyone who was willing to talk about it before. And so I wanted to you know, for those women who are going to be watching this, I wanted to get some insight from you on what that is, how to be with it, you know, in a really loving and connected way.
It really is trying to just transcend that stigma. I mean, probably nothing has more stigma in society than HIV. And, you know, learning how to love yourself and realizing that there's ways to live with it, better ways all the time, that technology and, you know, that we're learning about, and how to improve the immune system and how to support people with it. So
Yeah.
it's no longer a death sentence
Right.
like it used to be. So we need to not treat it with the same type of stigma and fear that it created in the past.
Right.
I think so much of that with fear creates stigma because we're afraid of it, so we want to wall it off and avoid everybody who might be dangerous.
Yeah. There's something really important about that fear, and as we're talking about nervous system and like relaxing into surrender,
You pull away.
you pull away.
Fear, fear as an emotion, it's a strong emotion, and you pull away.
Yeah.
And if she is here, right, and if I want to create a healing effect, the first thing is for me to connect with her.
Right.
Now that connection could be a gentle touch, and that's really the habit of shaking hands or hugging,
Right.
or it could be by saying hello.
Right.
So there's some type of a connection that needs to occur. Now, if I am fearful of Jeni and I pull away, then that's what Dr. Whitman is speaking of. Jeni becomes a lot more virulent and aggressive towards me. So when you look at society, you see, one of my teachers used to say when I was doing a rotation in India, and with patients who had leprosy, Mycobacterium leprae, which he would bring them outside, or he would lift up the curtain, and he would say, "Sunlight is the greatest antiseptic." Now there was a metaphorical aspect, right, to what he was saying.
Right.
See, there is what we reveal, we heal. I think if we live in a society that the current zeitgeist is that if you have this disease, you're bad, you need to be shunned, you can't be touched, stay away from me, or then what that creates is darkness. And that darkness, you see, then you have people that they're far from that place of healing. So the first place is very eloquently what you both said, which is we are souls having a human experience. With the medical model is exactly the opposite. It's like you're a human being and you may have soul or not. We can't see it, we can't stain it, we can't do a radiological study, or you may not. But that's it. That's a bottom-up theory that is very dissected, right? Because you keep cutting down a human being to different parts, different organs, different cells. You look at it under a microscope, but you're missing the whole aspect of what a human being is.
Right.
You're far more than a medical diagnosis. So when you can have a nestedness such as something which is nested, right? A nestedness, like literally like a nest, right?
Yes.
It's like, I love this. It reminds me, it says there are 3 eggs, and it says self-love, self-acceptance, and self-forgiveness. I've written a whole book just on these principles, right? So these eggs are nested, right? So a pathology, whether it's a flu or a joint pain or or HIV or human herpes virus or cancer, it could be contextualized and nested in a way of being, in a consciousness that consciousness by itself will create a morphic resonance that creates spontaneous remission. When the cancer evaporates. And we don't even know what happened. We give it a name, a spontaneous remission, but it was a person that did not fear the cancer. They understood that this is just a guest in their guest house.
Right, Rumi.
And they connected it, right? As Rumi so eloquently verbalized, and you connect with it and you realize that, wow, this has been sent here from beyond, and it has a particular message. What is the message? Then you get a human being that says, you know what, I don't really want to be an attorney. And they give that up and they start a new life, right? And they realize that they want to contribute to this incredible experience that we're all part of called life.
Yeah.
You see, that's why for me, I think having had some challenges, including cancer, it was a wake-up call. I realized that I didn't want to become a neuro-ophthalmologist, that I was literally an asshole. And it really helped me to revamp my entire life and to start a new journey. Most people, their secret prayer is to get herpes or HIV or cancer. And I say that intentionally because they're dead and they're walking dead in their lives.
Yeah.
And they're walking around, but there is no ounce of joie de vivre or juice or vigor or craving of being alive. That's what this conversation is about.
True. Moving into the joie de vivre. Like, if somebody told me here just before we came, they're like, oh, Jeni, I'm not surprised that's happening to you because you love some intensity. And so it's like, and then I thought, I was like, really? And I was like, oh, she's so right. It really brings me alive. It like keeps me on my toes. I have to learn some new things. I have to find my integrity to get my bone mass back, and it's from there that I find out who Jeni really is. Like in a way that I would have never seen before.
Absolutely right. You look at the pathology of, you look at where, the greatest reservoir that you keep, that which is a currency physiologically, which is calcium, right? Most enzymes in the body, they need calcium to be activated and so forth. Calcium is precious. That's why you keep it inside the bone. The blood is really irrelevant. When you do a simple blood test, that's already half a year to a year dated. The bone is where the party is. The calcium is the thing. Now look at what happens when you have a society that keeps continuing an individual. They keep acidifying their blood because they're angry, they're hurt, they're being attacked, they're unhappy. Well, in order to neutralize the acidity, what do? You mobilize calcium from inside the bone into the blood, right? That's how you can neutralize it. But now what do? Well, the blood needs to be filtered, and it gets filtered through the kidneys.
Right.
So now you literally are urinating out your calcium, and you're creating nephrolithiasis or kidney stones.
Right.
And then later on in the late four decades of life or fifth decades of life, now you have the reservoir, the bone is thinned out. See, that this is not about, that there is a shortage of Fosamax or this or that medication.
Right.
This is about how can consciousness be shifted and changed so that the phenotypic expression, so that your bone can shift and change.
Right.
So now you can see the beauty of your own biography of how something occurred and it created a pause and you could create value for who you are as a human being, which is far more important than the labels that anyone gives you. That's a soulful way of being.
It's true. There's a freedom in that beyond anything. Because then I find myself in any situation. I am not prisoner to whatever comes my way. There's an openness and a surrender.
And a true emancipation. Yes. Where, and I tell patients, listen, I've had the privilege of caring for people that they have stage 3, stage 4 cancer, but they have cancer. Cancer doesn't have them. There is a way of being that a human being can have, you name it. I mean, we make up pathologies and we give them a fancy name, right? Restless leg syndrome. I mean, whatever you want to name it, right? The top 7 marketing companies in the world, God bless them, the big pharma, right? And we need them. Listen, I have a prescription pad. I'm a family doctor. I'm not throwing the baby out with water. What I'm saying is, can we bring common sense back into what it means to be a human being? Because the way that you relate to anything, including a pathology, whether it's a flu or headache or herpes or HIV or HPV, you name it, right? the way that you relate to it is far more important than that pathology.
Exactly.
And that predetermines the outcome.
Yeah. Beautifully said.
That predetermines the outcome.
Yeah.
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 Profound.
Mm-hmm. We get
And that's the beauty of what she's doing. That's why I was very excited, and it's really a privilege, to sit with you and to hear you, because I think what you're offering is more than just including a camera and a digital iPad.
Right.
I think what you're including is depth to what it means to be a feminine,
To
it's
be a
the
woman.
sacredness
Yeah.
back into that femininity, and I think it will shift and change not only the psyche of the individual, the woman, not only the psyche of the family, but the psyche of the society.
Mm-hmm.
You see, where that depthfulness comes back to society.
Yeah, that humanity comes back
Yes.
into how we care for health.
Yeah.
Realizing that.
Yeah. It feels like there's this collective ideology of like who's good and who's not. And like one by one, people are finding their own way out of that and creating this new thing. And you are a powerful part of that experience, creating this new and connected and soul surrendered.
Well, when I see how empowered it helps women be, that's what lights me up. When you take a woman who previously thought herself dysfunctional and now help her see she's whole and healed and powerful,
Yeah.
that is exciting to be a part of.
Yeah. And it goes beyond just that one. That's an experience that carries a lifetime.
And it's not easy, Jenny.
Yeah.
It's not easy to stand there and to say this works and this is how I'm going to do it, because we come from a society, a medical society, that we have our own language. We have medical jargon because we like that separation, right? We have acronyms after our names. We have the long white coats. So for her to stand up in front of her colleagues and to introduce a new way of doing things, that takes a lot of courage. Because when you look at society, when you look at people, okay, a lot of people, they've come before us, such as Ignaz Semmelweis, right? Ignaz Semmelweis, all he said was, wait a minute, I'm going from cutting out dead people, right, from the anatomy lab to delivering babies. Could it be that me not washing my hands has something to do with the high rate of mortality and morbidity of women and kids and their babies? You know what happened to him? He lost his license. He was ostracized. He was placed in a psychiatric asylum. He was either killed or he killed himself. But right now, if you go to Austria, the largest university, it has the most giant, larger than life-size statue
Of him.
Semmelweis. So what she's doing, it's revolutionary in terms of being a trailblazer and creating a new way of doing things that will affect not only the body, not only the mind and spirit, but the psychology of the culture that we're all swimming in, like fish in a sea.
It's beautiful.
Thank God.
Yeah.
Thank God. Not like you.
Yeah.
Wow. Well, it lights me up. I have a passion for it, and I feel like, it's a huge soul mission to just develop this and bring it out in the world. So I love talking about it.
Thank you. You always have a place here.
Thank you.
Yeah, it's been a pleasure. Yeah, I feel like we've covered a lot today. Once again, learned a lot about ourselves and our souls and surrender, about our nervous systems, our calcium, our integrity, and what it really means to be a connected and healthy human in a way that matters. Yeah, in a way that's healing.
And thank you for doing what you're doing and really getting the message out and being such a trailblazer, both of you, supporting each other and creating that interconnectedness and the terrain that all of this can be conducive enough and people can hear it.
Yeah.
And ask for it. Ask for this way of doing things.
Yeah.
Listen, people go to a particular cafe to get their, latte certain way, right? This is an important part of the body.
Yeah.
They can, it's like capitalism at its best, supply and demand. If there is a demand, then before you know it, she will be asked, within the American College of Obstetrics and Gynecology to present and to give continuing medical education. Really, that's the intention and the prayer that we send forward, the blessings of that.
That is. So many can have and feel themselves and know themselves in that way.
Yeah.
The beginning. All right. Thank you, everyone. That's it for today.